What are the critical factors that contribute to the prevention of healthcare-associated infections, HIEs, and how should healthcare professionals ensure compliance with infection control protocols in a high-risk environment such as an intensive care unit? Answer: preventing healthcare-associated infections, HIEs, requires a multifaceted approach combining strict adherence to infection control protocols, proper use of personal protective equipment (PPE), and effective sterilization and disinfection procedures. Key factors include hand hygiene. Hand hygiene is the most effective measure in preventing HIEs. The World Health Organization (WHO) and the Centers for Disease Control and Prevention (CDC) provide detailed guidelines on hand hygiene, emphasizing the importance of hand washing with soap and water or alcohol-based hand rubs in preventing cross-contamination. Healthcare professionals must wash their hands before and after patient contact, before performing any invasive procedures, and after touching potentially contaminated surfaces. Use of PPE in high-risk environments like the ICU is critical to ensure that PPE, such as gloves, gowns, masks, and face shields, is used appropriately based on the patient's condition and the potential for exposure to infectious materials. Sterilization and disinfection. Healthcare settings must follow CDC guidelines on sterilization and disinfection procedures to minimize the risk of infection from contaminated medical instruments, surfaces, and equipment. This includes using hospital-grade disinfectants for surfaces and ensuring proper sterilization of reusable medical devices. Compliance should be monitored using regular surveillance of infection rates, periodic audits, and feedback mechanisms. The facility should also invest in ongoing staff training and provide regular updates on new infection prevention protocols. Explain how healthcare organizations can effectively implement a surveillance system to monitor healthcare-associated infections, HIEs. What role does the data collected play in improving patient safety outcomes? Answer: an effective infection surveillance system relies on the continuous collection, analysis, and reporting of infection data to prevent the spread of healthcare-associated infections, HIEs. Key elements include data collection. This involves tracking incidents of HIEs such as surgical site infections, catheter-associated urinary tract infections, CORTI, and ventilator-associated pneumonia. VAP data analysis. The data should be analyzed to identify patterns, trends, and potential outbreaks. This could involve the use of statistical methods like trend analysis or cluster detection to spot rising infection rates or identify areas where infection control measures may be failing. Reporting. Regular reporting of HAIR data to regulatory bodies such as the Centers for Medicare and Medicaid Services (CMS) or state health departments is mandated. This ensures transparency and accountability. Continuous improvement. The data collected should feed into a continuous quality improvement (CQI) process where the infection prevention team identifies the root causes of infection spikes and implements corrective actions, such as revising protocols or enhancing staff education. How can the integration of electronic health records (EHR) systems improve patient safety in clinical settings, and what challenges might arise from their implementation? Answer: the integration of electronic health records (EHR) into clinical settings can significantly improve patient safety by reducing medication errors. HRS enhance medication safety by providing clinicians with accurate, up-to-date patient medication histories, which help prevent adverse drug interactions, incorrect dosing, and duplicate prescriptions. Improve communication. HRS facilitate better communication between healthcare providers by ensuring that patient data is accessible in real time. This leads to more coordinated care, especially in complex cases requiring multiple specialists. Decision Support System (DSS). HRS can integrate decision support tools, such as alerts for abnormal lab results or warnings for potential drug interactions, that help clinicians make informed decisions quickly. However, challenges in EHR implementation include system downtime and technical failures. Technical issues such as system crashes or slow processing speeds can disrupt workflow and lead to delays in care delivery. User training. Inadequate training of healthcare providers in using the EHR system can result in errors, such as incorrect data entry or failure to follow up on alerts. Data security risks. The increasing volume of patient data stored electronically raises concerns about cybersecurity, making it crucial to implement strict safeguards, including encryption, access controls, and regular audits to prevent unauthorized access. Dr. Green is a physician at a busy urban hospital. He recently started recommending a mobile health application to his patients for managing their chronic conditions, but he has concerns about its security and accuracy. What steps should Dr. Green take to ensure that the mobile health application is safe and reliable for patient use? Answer: Dr. Green should take several steps to ensure that the mobile health application is safe and reliable. Verify the app's regulatory approval. Dr. Green should confirm whether the mobile health application complies with relevant regulations, such as those set by the U.S. Food and Drug Administration (FDA) for mobile medical devices. Assess security measures. Dr. Green should verify that the app adheres to best practices for data security. This includes ensuring that the app uses encryption to protect sensitive patient data and that it complies with privacy laws such as the Health Insurance Portability and Accountability Act (HIPAA) in the US, which sets national standards for the protection of health information, evaluate accuracy and evidence. Dr. Green should check if the mobile health app is backed by clinical evidence or research indicating its effectiveness in managing chronic conditions. He may also consider reviewing patient feedback or consulting with other healthcare professionals regarding their experiences with the app. Patient education. Dr. Green should educate his patients about the app's functionalities, limitations, and privacy considerations. Why is hand hygiene considered the cornerstone of infection prevention, and what are the key strategies for ensuring compliance with hand hygiene protocols in a hospital environment? Answer: hand hygiene is considered the cornerstone of infection prevention because hands are the most common vehicle for transmitting pathogens in healthcare settings. Research shows that inadequate hand hygiene is a leading cause of healthcare-associated infections. Highs. To ensure compliance with hand hygiene protocols, key strategies include clear guidelines and training. Healthcare facilities must provide clear hand hygiene protocols as outlined by the World Health Organization (WHO) and the Centers for Disease Control and Prevention (CDC). Visible reminders. Placing hand hygiene stations throughout healthcare settings and displaying visual reminders, such as posters, can help reinforce the importance of proper hand hygiene. Monitoring compliance. Regular monitoring and auditing of hand hygiene compliance are crucial. This can include direct observation of healthcare providers' hand hygiene practices or using electronic monitoring systems to track hand hygiene events. Incentives and accountability. Institutions should create a culture of accountability by using performance reviews, feedback systems, and even reward programs to encourage compliance with hand hygiene protocols. What are the main considerations when selecting the appropriate personal protective equipment (PPE) or a healthcare worker in a setting with known airborne and droplet-borne pathogens, and how should PPE use be monitored for compliance? Answer: when selecting PPE for a healthcare worker in a setting with known airborne and droplet-borne pathogens, the following considerations are critical. Type of pathogen. For airborne pathogens like tuberculosis, TB, or COVID-19, healthcare workers should wear air respirators or higher level protection. For droplet-borne pathogens, a surgical mask along with eye protection, goggles, or face shields may be sufficient. Procedure type. The level of exposure risk associated with the procedure being performed should guide PPE selection. For high-risk procedures, e.g. intubation, suctioning, more extensive PPE, such as powered air purifying respirators, PAPRs, or full-body suits may be necessary. Risk assessment. Healthcare facilities should assess the risk of exposure based on the type of patient population, e.g. immunocompromised patients, and the clinical environment. PPE compliance can be monitored through regular audits, spot checks, and direct observation. Additionally, training programs should be conducted to ensure proper PPE, donning, doffing, and disposal techniques to minimize contamination risk. What are the primary safety risks associated with telemedicine, and what measures can healthcare providers take to mitigate these risks while ensuring effective patient care? Answer: the primary safety risks associated with telemedicine include inaccurate diagnosis. Telemedicine platforms may limit a healthcare provider's ability to conduct a thorough physical examination, potentially leading to misdiagnosis. To mitigate this risk, providers should rely on a comprehensive patient history, ask specific questions, and encourage patients to describe symptoms in detail. Data privacy and security. Telemedicine platforms may pose risks to patient confidentiality if they do not adhere to data privacy regulations like HIPAA. Healthcare providers should ensure that telemedicine platforms are encrypted and comply with HIPAA standards for protecting patient information. Technology failures. Technical issues such as poor internet connections or software glitches can disrupt patient-provider communication. Providers should offer alternative methods of communication, e.g. phone consultations, if telemedicine is not feasible. To mitigate these risks, healthcare providers must establish protocols for telemedicine consultations, ensure staff are adequately trained, and use secure, reliable telemedicine platforms. How can the use of data analytics in surveillance improve infection control practices in a healthcare setting? Answer: data analytics significantly enhances infection control practices by providing actionable insights into infection patterns, potential outbreaks, and resource utilization. Through predictive analytics, healthcare facilities can forecast infection risks and identify trends before they escalate into outbreaks, enabling timely interventions. Key aspects of data analytics include trend identification. By analyzing historical infection data, healthcare providers can identify trends such as seasonal spikes in infections or areas with consistently high infection rates. Risk stratification. Analytics can help categorize patients based on their risk for specific infections. For example, by analyzing patient comorbidities and past medical history, a hospital can predict which patients are most vulnerable to infections like pneumonia or surgical site infections, guiding preventive strategies, evaluating effectiveness. Data analytics also allows healthcare facilities to assess the effectiveness of their infection prevention protocols, such as hand hygiene compliance or the use of personal protective equipment (PPE). Resource allocation. Effective data analysis enables better allocation of resources like staffing, PPE, and infection control supplies. What are the differences between sterilization and disinfection, and when should each be used in a healthcare setting? Answer: sterilization and disinfection are both essential in healthcare settings, but differ in the degree of microbial destruction they achieve. Sterilization is a process that completely eliminates all forms of microbial life, including bacteria, viruses, and spores. It is typically required for instruments and equipment that come into direct contact with sterile body tissues or fluids, such as surgical instruments, implants, and needles. Methods of sterilization include autoclaving, steam under pressure, dry heat, or the use of chemicals like ethylene oxide. Sterilization is vital in preventing infections during surgeries or invasive procedures. Disinfection, on the other hand, reduces the number of viable microorganisms to a safe level but does not eliminate all pathogens, particularly bacterial spores. Disinfection is used for non-critical items that come into contact with intact skin or mucous membranes, such as stethoscopes, blood pressure cuffs, and bed linens. Common disinfectants include bleach, alcohol-based solutions, and quaternary ammonium compounds. The decision between sterilization and disinfection depends on the item's intended use and the risk of infection it poses. For example, an instrument used for a minor procedure may only need disinfection, while tools used in surgery require sterilization to prevent infection. How can the integration of electronic health records (EHR) systems improve patient safety in clinical settings, and what challenges might arise from their implementation? Answer: the integration of electronic health records (EHR) systems can greatly enhance patient safety in clinical settings by improving the accessibility, accuracy, and coordination of patient data. Improved data accessibility (HRS) provide healthcare professionals with real-time access to a patient's medical history, test results, allergies, medications, and previous treatments. This reduces errors related to missing or outdated information, which is particularly important in emergency or fast-paced clinical environments. Clinical decision support (CDS). HR systems often come with built-in CDS tools that alert providers to potential issues like drug interactions, incorrect dosages, allergies, or abnormal lab results. These alerts help reduce the chances of medication errors and adverse drug reactions. Better communication and coordination. HRS facilitates seamless communication among healthcare providers, ensuring that all team members are aware of the patient's condition and treatment plan. This is especially useful in multidisciplinary care settings and reduces the risk of duplicated tests or conflicting treatments. However, challenges include training requirements. Healthcare professionals need extensive training to use the HR systems effectively. Without proper training, there is a risk of misusing the system, leading to errors in documentation or missed alerts. System downtime. HR systems are vulnerable to technical failures, such as system crashes or server downtime, which can disrupt patient care. Backup systems and protocols must be in place to handle such situations. Data privacy, ensuring that HRS comply with privacy regulations like HIPAA is critical to protect patient data from breaches. What are the core principles behind the Surgical Safety Checklist, and why is its implementation crucial in preventing adverse outcomes in the operating room? Answer: the Surgical Safety Checklist (SSC), as recommended by the World Health Organization, WHO, is a tool designed to improve the safety and outcomes of surgery. The checklist typically includes preoperative, intraoperative, and postoperative phases to ensure the team follows critical safety protocols and addresses essential factors. Key principles: preoperative verification ensures that the correct patient, procedure, and site are identified before starting surgery. Intraoperative safety measures includes confirming anesthesia, antibiotic prophylaxis, and communication between team members. Postoperative debriefing: a debrief after surgery to review the process and ensure any complications are immediately addressed. The implementation of this checklist is critical to prevent surgical errors like wrong site surgeries or retained foreign bodies, promote team communication and ensure that all team members are aligned on patient care, comply with safety protocols outlined in the Joint Commission Standards and Institute of Medicine's IAM report on patient safety. Mr. Thompson has undergone an elective abdominal surgery. Postoperatively, he experiences a sudden rise in temperature along with pain and redness at the incision site. What should the healthcare team suspect and what immediate actions should be taken to prevent further complications? Answer: Mr. Thompson's symptoms, fever, pain, and redness at the surgical site, are concerning for a surgical site infection. SSIS is one of the most common postoperative complications and can lead to prolonged hospital stays, increased healthcare costs, and worse patient outcomes. What should the team suspect? Infection at the surgical site, which may be caused by poor aseptic techniques during surgery, insufficient antibiotic prophylaxis, or contamination after surgery. Risk factors for SS: diabetes, smoking, immunocompromised states, and prolonged surgery times. Immediate actions: assess the surgical site for signs of infection, discharge, swelling, increased pain. Initiate antibiotic therapy based on the surgeon's protocol or the culture of the wound if necessary. Implement infection control protocols as outlined by the CDC, including wound care, isolation if necessary, and proper hand hygiene. Notify the surgical team immediately to assess for the potential need for surgical interventions such as drainage of the abscess. Explain the concept of anesthesia safety in the context of patient safety. How can anesthesia-related risks be minimized during surgery? Answer: anesthesia safety is a critical aspect of overall patient safety in the surgical environment. Anesthesia-related complications, such as airway obstruction, allergic reactions, or incorrect dosing, can lead to severe patient outcomes, including death. How can anesthesia-related risks be minimized? Preoperative assessment: thoroughly assess the patient's health status, including allergies, previous anesthesia experiences, and any pre-existing conditions that may affect anesthesia management. E.g., cardiac or respiratory disease. Monitor vital signs continuously. During surgery, maintain close monitoring of heart rate, blood pressure, oxygen saturation, and end-tidal co to detect early signs of complications. Use of appropriate equipment. Ensure that all anesthesia equipment is properly maintained and calibrated, including ventilators, monitors, and emergency supplies. Team communication. The anesthesia provider must communicate effectively with the surgical team, ensuring the patient's needs are met throughout the procedure. Compliance with American Society of Anesthesiologists (ASA) standards and Joint Commission guidelines is crucial in minimizing risks associated with anesthesia. What are the primary fall risk factors for patients in a hospital setting, and how should healthcare teams implement fall prevention strategies? Answer: falls in the hospital setting are a significant patient safety concern, especially among elderly patients and those with impaired mobility or altered mental status. Primary fall risk factors: age. Elderly patients are increased risk due to frailty, muscle weakness, and impaired balance. Medications, drugs like sedatives, antihypertensives, or diuretics may cause dizziness or hypotension, increasing the risk of falls. Cognitive impairment. Patients with dementia or altered mental status may be more likely to fall due to confusion or disorientation. Environmental factors. Cluttered rooms, wet floors, or inadequate lighting can increase the likelihood of a fall. Fall prevention strategies. Fall risk assessments. Use validated tools like the Morse Fall Scale or Hendrich I Fall Risk Model to assess patient risk on admission and during hospitalization. Patient education. Educate patients and their families about fall risks and the importance of calling for assistance. Environmental modifications. Ensure that patient rooms are free from obstacles, floors are non-slippery, and call lights are within reach. Staff training. Train staff to identify high-risk patients and use appropriate interventions such as bed alarms or physical therapy to maintain mobility. The CDC's falls prevention guidelines and hospital safety standards should be adhered to in all fall prevention protocols. Mrs. Jenkins, a 72-year-old woman with a history of osteoporosis, has been admitted to the hospital for hip surgery. She has a history of falls at home. Based on her fall risk factors, what specific strategies should be employed to reduce her risk of falling during her hospitalization? Answer: Mrs. Jenkins' history of osteoporosis combined with her age and history of falls places her at a high risk for falls. Several strategies should be implemented to reduce her risk while hospitalized. Strategies to reduce fall risk. Fall risk assessment. A Morse fall scale or similar tool should be used to formally assess her fall risk on admission. Fall prevention protocols. Implement standard fall prevention protocols such as non-slip footwear, bedside alarms to alert staff if the patient attempts to get up, ambulation assistance. Ensure that staff assists Mrs. Jenkins when she needs to move, especially post-surgery when she may experience decreased mobility. Pain management. Properly manage her pain to reduce the likelihood of falls caused by dizziness or impaired mobility. Physical therapy. Initiate early physical therapy to help her regain strength and improve balance as she recovers. Patient and family education. Teach Mrs. Jenkins and her family about the importance of calling for assistance when needed and avoiding unassisted movement. Given her history of falls, this patient is classified as high risk, and additional interventions such as close monitoring by staff and modified hospital routines should be put in place. How does team communication impact patient safety in the operating room, and what strategies can be implemented to improve communication among surgical team members? Answer: effective communication in the operating room is crucial to preventing adverse events and ensuring patient safety. Miscommunication or lack of communication among surgical team members can result in errors such as incorrect procedures, wrong site surgeries, or medication errors. Impact on patient safety. Team coordination. Clear communication ensures that all team members are on the same page regarding patient identity, surgical site, and procedure specifics. Reduction of errors. Effective communication helps prevent errors in anesthesia administration, instrument management, and patient positioning. Strategies for improving communication. Standardized protocols. Implement structured tools like the WHO Surgical Safety Checklist to guide team communication and ensure all critical steps are covered. Briefings and debriefings. Conduct preoperative briefings to discuss the surgical plan and postoperative debriefings to assess what went well and what needs improvement. Role clarity. Ensure that each team member knows their specific role and responsibilities, minimizing ambiguity during critical moments. What are the most effective methods for preventing surgical site infections, SIS, and what role does antibiotic prophylaxis play in this effort? Answer: preventing surgical site infections, SIS, is essential for reducing complications, prolonged hospital stays, and improving patient outcomes. Effective methods to prevent SIS. Sterile technique, ensuring the highest levels of aseptic techniques are used during surgery, including hand hygiene and maintaining a sterile field. Antibiotic prophylaxis, administering appropriate antibiotics before the incision is made, typically within 60 minutes of incision, to reduce the risk of infection. The choice of antibiotics should be based on the likely pathogens involved and patient-specific factors, e.g., allergies. Postoperative care. Proper wound care after surgery, including maintaining a clean and dry dressing, control of environmental factors. Implementing proper air quality controls, e.g., laminar airflow, and infection prevention in the operating room. Guidelines such as those from the CDC and Infectious Diseases Society of America (IDSA) help define appropriate prophylaxis timing and choice of antibiotics. What specific challenges do patients with compromised immune systems face in the postoperative period, and what additional precautions should be taken to safeguard their safety? Answer: patients with compromised immune systems, e.g., due to HIV, chemotherapy, organ transplants, face increased risks of infections, delayed wound healing, and postoperative complications. Challenges: increased infection risk. Due to the inability to mount an effective immune response, these patients are at high risk for SSs and hospital-acquired infections. Delayed wound healing. The immune system plays a key role in tissue repair, and compromised immunity may delay recovery from surgery. Increased vulnerability to sepsis. These patients may not exhibit typical signs of infection, leading to delayed diagnosis and treatment of sepsis. Additional precautions: enhanced infection control. Implementing strict isolation protocols to protect immunocompromised patients from exposure to infectious agents. Close monitoring, continuous monitoring for signs of infection with early initiation of antibiotic therapy if needed. Explain the role of post-fall protocols in the prevention of secondary injuries after a fall in a hospital setting. Answer: post-fall protocols are designed to assess and manage patients who have already experienced a fall in order to minimize further injury and prevent future falls. Key components of post-fall protocols. Immediate assessment. Quickly assess the patient for any injuries, fractures, head trauma, etc., and monitor vital signs. Investigation. Identify the root cause of the fall using patient history, environment assessment, and medications review. Reevaluation of fall risk. Update the patient's fall risk status and implement additional interventions as needed. Documentation. Ensure that the fall is documented accurately in the patient's medical records to comply with Joint Commission requirements and improve future care. Best practices. Hospitals should follow the CDC's fall prevention guidelines and ensure that patients who fall are immediately assessed and receive appropriate care. Discuss how team communication in the OR can be enhanced by technological innovations like the use of electronic health records, (EHR), and digital communication tools. Answer. Technology can greatly enhance team communication in the operating room or ensuring a more streamlined and accurate exchange of critical patient information. Technological innovations. Electronic health records (EHRs) allow real-time sharing of the patient's medical history, allergies, and surgical plans, ensuring all team members have access to the same up-to-date information. Digital communication tools. Tools like secure messaging systems or OR communication platforms enable faster, more efficient exchanges between surgical teams and supporting staff. Surgical navigation systems assist surgeons in precise decision-making, offering real-time imaging and updated patient data, reducing the risk of errors. These innovations align with guidelines set by bodies like the Joint Commission to improve communication and reduce surgical errors. What are the primary types of medication errors, and what strategies can healthcare institutions implement to reduce their occurrence? Answer. Medication errors are broadly categorized into the following types. Prescription errors. Errors in the written order for medications, e.g. incorrect dosage, drug name confusion. Dispensing errors. Mistakes made by pharmacists or healthcare providers while preparing or distributing the medication. Administration errors. Mistakes made during the act of administering the drug to the patient, e.g. incorrect dosage or route of administration. Monitoring errors. Failures in monitoring the drug's effect on the patient post-administration, which can include overlooking side effects or interactions. To reduce medication errors, healthcare institutions can implement several strategies, including standardized protocols, using evidence-based guidelines to standardize medication prescribing, dispensing, and administration. Training and education. Ensuring that all healthcare professionals involved in medication management are adequately trained on medication safety. Technology integration. Employing electronic health records, as computerized physician order entry, CPO, and barcode scanning to reduce human error and improve tracking. Medication reconciliation. Establishing a system to verify the patient's current medications during admission, discharge, and transfers to avoid duplication or omission of essential drugs. What is the role of medication reconciliation in preventing adverse drug events, ADES, and what guidelines should be followed to ensure it is conducted effectively? Answer. Medication reconciliation plays a vital role in preventing ADEs by ensuring that there are no discrepancies between the medications a patient is taking upon admission, during treatment, and upon discharge. It involves a comprehensive review of the patient's medication list and comparing it to the orders in the clinical setting to identify and resolve discrepancies such as omissions, duplications, or drug interactions. Guidelines for effective medication reconciliation. National Patient Safety Goals. According to the Joint Commission's National Patient Safety Goals, healthcare facilities must implement medication reconciliation across the continuum of care. Involvement of patients and families. Patients and their families should be encouraged to bring an updated list of medications to each healthcare visit. Pharmacist and clinical team involvement. The pharmacist should be actively involved in the reconciliation process, collaborating with physicians and nursing staff to ensure the accuracy of medication lists. Electronic systems. The use of electronic medication management systems, e.g. CPO, to reduce errors related to handwriting or transcription. How can the healthcare system mitigate diagnostic errors, and what are the key factors that contribute to these errors? Answer. Diagnostic errors occur when a healthcare provider fails to correctly diagnose a patient's condition, which can result from misinterpretation of data, failure to consider all possible diagnoses, or communication failures. Key factors contributing to diagnostic errors. Cognitive biases. Healthcare providers may rely on heuristics or past experiences, leading to errors in judgment, e.g. anchoring bias, where the provider focuses on the first diagnosis considered. Inadequate communication. Poor communication between healthcare providers, such as incomplete handoffs or failure to share test results in a timely manner, can lead to errors. Systemic issues. A lack of protocols or failure to use evidence-based clinical pathways can contribute to diagnostic errors. Litigation strategies encourage second opinions. Implementing a culture where clinicians are encouraged to seek second opinions, especially in complex or ambiguous cases. Improved diagnostic tools using advanced diagnostic technologies, e.g. AI in imaging, clinical decision support systems to assist healthcare providers in identifying potential diagnoses, education and training, regular training on cognitive biases, and effective communication strategies to reduce diagnostic errors. Mr. Martinez is a 65-year-old patient with a history of hypertension and diabetes. Upon admission to the hospital, his medication list is incomplete and a critical antihypertensive drug is missing. The attending physician prescribes a new antihypertensive drug that interacts with his diabetes medication, increasing the risk of hypoglycemia. What should the hospital staff do to prevent an adverse drug event in this case? Answer: in this scenario, the hospital staff should immediately perform the following actions to prevent an ADAIR. Medication reconciliation. The first step is to conduct a comprehensive medication reconciliation by verifying all of Mr. Martinez's current medications, including those taken at home. This can involve reviewing his medication history, speaking with his family, or consulting with his primary care physician. Identification of drug-drug interactions. The new antihypertensive drug must be checked for potential interactions with his diabetes medication. This can be done using clinical decision support tools integrated into the electronic health record (EHR) system to flag such risks. Adjusting the medication plan. If an interaction is identified, the healthcare team should either adjust the dosages of the medications involved or choose a safer alternative. This might involve switching the antihypertensive to a drug that does not interact with the diabetes medication. Patient monitoring. Close monitoring of blood glucose levels is necessary to ensure that the interaction does not lead to hypoglycemia, and the healthcare team should adjust treatment as needed based on patient response. What are high alert medications, and why is it crucial to manage them carefully within healthcare systems? Answer: high alert medications are drugs that have a high risk of causing significant harm when used in air. These include medications such as anticoagulants, chemotherapy agents, insulins, and opioids. The risk of harm can result from incorrect dosage, administration, or monitoring, while high alert medications must be carefully managed. Narrow therapeutic index. Many high alert medications have a narrow therapeutic index, meaning small changes in the dose can lead to toxicity or therapeutic failure. Severe consequences of error. Errors in administration can lead to severe or fatal consequences, such as hemorrhage from anticoagulant overuse or overdose of opioids leading to respiratory failure. Specialized handling and monitoring. High alert medications require specialized handling, storage, and administration protocols. Additionally, they need more frequent monitoring, such as checking INR for warfarin or blood glucose for insulin. Management guidelines. Double checking. Healthcare institutions should implement double-checking protocols for high-alert medications where two qualified professionals verify the drug dose and patient technology, utilize automated dispensing cabinets and barcoding systems to ensure the correct medication is administered. Education and training. Regular training for all healthcare staff involved in the administration of high-alert medications to minimize errors. What strategies can be employed to reduce the risk of surgical errors during a procedure? Answer: surgical errors are often preventable with the right precautions. Several strategies to reduce the risk of surgical errors include preoperative verification, ensuring that the correct surgical site, patient identity, and procedure are confirmed through checklists and surgical site marking before surgery begins. Timeout procedure. A timeout should be conducted immediately before the procedure begins to confirm patient details, the surgical site, and the team's readiness. Surgical checklists. Using surgical checklists, e.g., WHO's Surgical Safety Checklist, to guide the team through necessary safety steps before, during, and after the procedure. Team communication. Promoting open communication and a culture of safety where all team members feel comfortable speaking up if they notice something that could lead to a mistake. Post-operative monitoring. Ensuring that patients are closely monitored for any signs of complications post-surgery and that any issues are addressed promptly. What is the role of technology, such as electronic health records, EHRs, and barcode scanning, in improving medication safety in hospitals? Answer: technology plays a critical role in improving medication safety by providing systems that reduce the risk of errors during prescribing, dispensing, and administering medications. Key roles of HRS and barcode scanning include A's. These systems facilitate the safe prescribing of medications by incorporating decision support tools that alert healthcare providers about potential drug interactions, allergies, and dosing errors. Barcode medication administration, BCMA. Barcode scanning ensures that the right patient receives the right medication by scanning both the medication and the patient's wristband. This helps to confirm patient identity and the medication being administered, reducing human error. Automated dispensing systems. These systems ensure that medications are securely stored and dispensed in precise doses, further reducing errors in drug preparation and distribution. How can healthcare facilities ensure the safety of high-risk patients undergoing high-alert treatments like chemotherapy? Answer: ensuring patient safety during high-alert treatments, such as chemotherapy, involves a multifaceted approach. Pre-treatment assessment. Conduct a thorough patient assessment, including reviewing the patient's medical history, current medications, and any known allergies or contraindications. Standardized protocols. Use evidence-based protocols for chemotherapy administration, including specific guidelines for drug dosages, administration routes, and monitoring requirements. Patient education. Educating patients about their treatment plan, potential side effects, and the importance of adhering to the prescribed regimen. Staff training and competency, ensuring that healthcare staff involved in chemotherapy administration are properly trained and regularly assessed on their knowledge of high-risk medications and safety protocols. Real-time monitoring, continuous monitoring of vital signs, laboratory results, and adverse reactions during the administration of chemotherapy drugs. Ms. Johnson, a 45-year-old patient with a history of asthma and hypertension, is prescribed a new medication for her asthma. After taking the medication, she experiences a mild allergic reaction. What steps should the healthcare team take to address this issue and prevent further harm? Answer: the healthcare team should immediately take the following steps. Assess the reaction. Determine the severity of the allergic reaction by evaluating symptoms e.g. rash, difficulty breathing, swelling. Discontinue the medication. If the reaction is confirmed to be related to the medication, it should be discontinued immediately. Provide emergency care. If necessary, administer appropriate emergency treatments such as antihistamines, corticosteroids, or epinephrine, depending on the severity of the reaction. Document the event. Properly document the allergic reaction in the patient's medical record, including the suspected drug involved, symptoms, and treatment administered. Review the medication list. Ensure that Ms. Johnson is not prescribed any other medications that could interact with her asthma treatment or cause further allergic reactions in the future. Why is patient safety particularly challenging when it comes to the management of high-alert medications in an outpatient setting, and what strategies can be used to mitigate these challenges? Answer: managing high-alert medications in an outpatient setting presents unique challenges due to factors such as patient non-compliance, lack of real-time monitoring, and communication gaps between outpatient providers and specialists. These challenges can lead to medication errors and adverse events. Mitigation strategies. Patient education. Providing thorough education on the importance of adhering to prescribed regimens and recognizing the signs of adverse reactions. Pharmacy involvement. Engaging community pharmacies to provide additional medication reviews and counseling. Follow-up care. Implementing scheduled follow-up appointments to monitor patient progress and adjust treatment as necessary. Use of technology. Utilizing mobile health apps or telemedicine to ensure ongoing monitoring of patients and timely adjustments to their medication plans.